Hello everyone, it's a pleasure to be here and very honored to be with among these people. So this is the first of a lot of interviews we're going to be doing with world-leading scientists, experts and people in different areas of expertise. We are in a very challenging moment of history, especially probably the biggest moment in the last 200 years. And probably in a lot of ways we can look at this as probably what is happening between the transition from the Roman Empire to the Middle Ages, because what is happening right now from a health perspective and economical perspective is shifting the world how we see it. And the purpose of this first interview that we are leading with the project and platform Citiesabc.com is to interview Professor Walczak, Henning Walczak, that is a leading professor and researcher in the areas of multiple areas actually, and I will let him to introduce himself. And he's been working between the UCL University right now and Cole University in Germany, and as well as been adding the Department of Cancer Biology in the UCL Centre here in London, but as well right now based in Germany, where he's actually looking at different areas of research. So the purpose of this interview is to, of course, give a light to the profile of Professor Walczak, but as well his research and as well his views in terms of Covid-19 coronavirus and what we are facing, and as well creating more awareness, because when you look at this, there's a lot of issues in terms of the way communication is coming, a lot of panic, but very low coordination worldwide. So that's the purpose of this first interview that we would like to highlight. And I'll pass the word to Professor Walczak. If you could make a small introduction about you, about your bio and your work, and then I'll go through a couple of questions.
Yes, thank you, Dinis, for this kind introduction. I've been working on cell death and the effects of cell death and inflammation for more than 20 years now. And as you just mentioned, I'm currently at the University of Cologne. I'm here as the Alexander von Humboldt Professor of Biochemistry, and I'm also the Professor of Cancer Biology at the UCL Cancer Institute. What we work on in my laboratories, in both at the University of Cologne and at UCL, is how cell death impacts inflammation. And we normally do that in the context of cancer and autoimmunity, but of course in today's world we have recently shifted our attention to seeing whether we can help in the fight against SARS coronavirus type 2, and of course also in fighting the disease COVID-19 that is caused by SARS coronavirus 2. And the way we think this may work is that, of course, as a cancer biologist and as an immunologist who works on cell death and inflammation, our angle is not to block the viral infection, but to deal with the aftermath in a better way. So it's very clear to us as people who've been working on the regulation between cell death and inflammation that there is too much inflammation here ongoing, and we think an hypothesis that we are following is that we think that this inflammation is a consequence of too much cell death that is not only induced by the virus killing cells directly, but also indirectly by the host response to this viral infection. And this viral infection is basically transmitted to the non-infected cells by interferons, and interferons then sensitize the rest of the cells in the lungs, that may be epithelial cells, but also cells in the blood vessels in the lungs, in the endothelium in the lungs, to the effect of so-called death ligands. Those are molecules that we ourselves make in our body that can keep normally infection at bay, but they can also go the wrong way. They can kill too many cells. and then this becomes problematic. So one way we think we can potentially address this is by blocking certain death ligands, and that's our current line of research, is trying to prevent the host-derived damage to the lungs that then, in fact, we think is what kills the people at the end stage of this disease. And if we can prevent this cell death in the non-infected lung cells, we think we can maintain lung function in people who are severely ill and people who are critically ill to an extent that we hopefully can get people back from severe to moderate disease and from critical to severe, and then also again back to moderate. So that in the end, we hope that we can prevent this disease from being lethal. Now, this is all currently hypothesis. We're doing the first experiments to see whether this may work. And I'm not doing this alone. I'm doing this with a team of scientists at the Francis Crick Institute, at the Medical University of Vienna, and also at the Center of Molecular Medicine in Vienna, as well as the University of Cologne here in my lab, and also at UCL Cancer Institute in Fitzrovia in London. So this is what we're currently doing, and I really hope that we're going to get the support of everybody that we need here. We need the different companies that can make the drugs that are currently that could block different death ligands or different effectors in the death pathways, in the cell death pathways that may be triggered in these cells whose lives we want to save in order to save the lives of the patients suffering from COVID-19 after infection by SARS coronavirus type 2.
So a couple of questions related with this. So for the, I think there's a component of science, the component of work international between different departments, and the component as well of support between the industry and governments. So let's start with this kind of coordination. What do you think, because I think that's at least what we've been seeing with the project Citiesabc.com, is the challenge with the coordination of different entities worldwide working to align efforts, and that's where it comes the work of Citiesabc.com and what you're trying to do with Professor Yu and a lot of other scientists in the world is making people talk in the same platform, at least knowing what is happening. Because at the moment right now is effectively, we see in the news and we see a lot of research of a lot of case studies and a lot of research being done, but there's not a global coordination of efforts. And I think if we get that global coordination, we might go faster because we are in a very big scale of devastation in terms of healthcare, but as well other consequences that are coming out of this. How do you see, Professor Walczak, in terms of your experience as a researcher between actually at the moment 3 countries and as well a lot of countries around the world, how can we optimize these efforts on a global scale? And on the, first of all, on the scientific community first, second on the industry community, and third, of course, in the governmental community?
Well, first of all, I think it is paramount to recognize that that in addition to trying to develop vaccines against SARS coronavirus type 2, we certainly need to work on better treatments. And in addition to antiviral medication, which is currently ongoing, we need to think about the host-derived mechanisms, and of course the combination of antiviral strategies and anti-host-derived mechanisms that drive lethality of this disease. And currently, I think the most important thing is that that governments, give us the possibility to do this type of research with the least restrictions possible. And the same applies to companies who may have drugs that only work when we combine them with one another, that we actually overcome what we normally have as problems with material transfer agreements. One company wants to own all of the intellectual property that can come out of this. I think we are in a situation where we have to put this aside for the moment. We have to now fight this disease. We have to fight this viral infection and the disease that comes with it. And we have to all join forces in order to do that. And I want to ask everybody, I want to appeal to everybody to use a very pragmatic approach in order to achieve that. Let's do what is possible, and then I think we can be the quickest in finding solutions to this paramount problem that we're currently facing.
So let's look in the scale of, let's say, at least 3-4 measures that you think can create a pragmatic approach. Because like we just mentioned, so in the case of the industries, there's the concept of shared IP, and of course, at the moment, all the geopolitics that are coming out of this. Of course, on the academic scientific world, I think that is clear that people want to find this. But the challenge right now is the lack of international hubs and bridges for all this research, because we're seeing a lot of politicization of the solutions for this. So what pragmatic approach could we have from your angle on the scientific side, and as well on the government angle? Because we need to be all on this together, because at the moment the devastation is just starting, and for instance the degree of growth on this is so big that we are only in the beginning. So I think that's, how do you see the pragmatic approach, especially from the research academic perspective?
So yeah, thank you for that question. I think it's a very important one. What we need is, of course, we're doing the research right now. We're working in cell culture. We're working in vivo with mice and with influenza models. Currently, we do not have access yet to models with the 2003 SARS coronavirus model that has been adapted to mice, and we could do similar experiments in mice if we had access to a worldwide network of laboratories where these experiments could be done. But that's all on the research side. I think that we can learn a lot from influenza models, from flu models, where the end stage of disease, this acute respiratory distress syndrome, ARDS, seems to be very similar between people with flu who are very severely ill and people with coronavirus, SARS coronavirus type 2, who are severely ill with COVID-19. And then that means that if we were to find something that works in an in vivo model with flu, then I think we have a very good rationale to take this forward into clinical testing in patients who are suffering from COVID-19 right now. So then we come to the clinical trials. So currently, when you look at the protocols and you look at what needs to be fulfilled in order to get a clinical trial going, everybody has been very pragmatic about this, but what we have encountered is there's still this question, sponsor. So who's going to sponsor this clinical trial? Obviously, I have total understanding of asking for sponsorship for clinical trials when it comes to testing a new cancer drug, where people may in the future want to make a lot of money. A pharmaceutical company may want to make a lot of money. In the current situation, I lack understanding for that question. I think we need to scrap that question for the moment and just get these clinical trials done and deal with the cost of this, amongst all nations. If we find something that works, this will basically help everybody save a lot of money and also a lot of lives in the future. I mean, you've seen hundreds of billions of dollars, thousands, in fact, of billions of dollars being spent or being put forward for spending over the next few months. If only a tiny fraction of this were to go towards fighting this disease, not only in the defense line, which is the hospitals, but let's talk about the offense. The offense, in my view, is us as the researchers, the people who are trying to develop new vaccines, but also the people who are trying to treat this disease so that we can convert what is now a deadly disease in 1 to 2% of the people into a disease that is not deadly anymore. And one thing that people always forget is it may only kill 1 to 2% of the population, which is already a large number if you look overall, but it also causes very severe lung disease in many patients who suffer from COVID-19, and many of these patients will actually take away a chronic lung disease, which may get back to them a lot later in life, maybe in a few years' time. And that's also what we need to prevent. We need to prevent this from making a very or a severe lung disease for many people who are infected who may not die. Yeah. So that is another thing that we need to consider when thinking about this disease here.
So one question related with the access to global network of laboratories and especially the clinical trials. So according to some research you've been doing, there's around 32 clinical trials going on related, at least in a scale that is more industry related in the world. So for instance, is there any, just from an academic question, direct question, for instance, are you talking with Chinese laboratories or South Korean laboratories at the moment, or you're purely looking with the universities that you are working directly?
So currently, I do not have contacts with laboratories in China who work in terms of what they have done in the past in order to treat the disease. Of course, I'm aware of all the literature around remdesivir and camostat and even hydroxychloroquine, even though that seems to be more anecdotal, at least at the moment. But those are antiviral approaches, and our approaches are a bit different. I think they can be highly synergistic. That said, we are working with a Chinese company that is producing the material that we actually are using in our preclinical models, and hopefully they will also be the ones who are producing the clinical material that we hopefully can use in the clinic in a few months' time if we are successful with our research. So all this said, I think we are in an international collaboration across the globe that is working, even though it's been a bit more difficult and more challenging during this time than it would be normally, also with sending around materials so that we can do this research. By the way, we're only sending around proteins, meaning potential drugs that we want to use in these animal models in order to see whether we can, at the moment at least, fight influenza A virus infection in these animal models. And then in the next step, we want to, of course, go to the SARS coronavirus models, but potentially then immediately into trials with patients.
So one of the questions, and being right now a bit more of a civic, that we've been facing, and especially that we're trying to push with the project, is the coordination. So what would be your recommendation as a scientist for cities and for mayors and for governments? Because we're seeing right now probably the biggest challenge is the lack of a global coordination effort towards the effects of the disease. And actually, there's a lot of panic and contradictions. For instance, I was reading a case study that Sweden did a completely different approach for anyone in the world. So they kept people in the streets and they kept schools open and everything else, which is probably one of the most advanced countries, which is a contradiction. And there's people saying that, for instance, this is a disaster. Of course, in UK, there was a delay in terms of what is happening with the approach, and now there's a complete lockdown of the country. What would be your scientific view on this, purely on the scientific side as a researcher? Because I think this is quite important to have this message taking forward, and we need to highlight a very global effort, because we cannot have like 20 different countries having 20 different approaches. Of course, there will be a complete disaster.
Well, I think that everybody is trying to do the right thing. However, not everybody is following scientific advice as they should. And of course, you can follow epidemiologists and virologists, or you can, or you can follow other scientists. In this case, I do think that to follow the advice of the virologist and epidemiologist is the right thing to do. And everybody that I've heard that has talked about this has said we have to flatten the curve. We have to keep the infection rate at the moment as low as possible, so that we do not have a situation in the hospitals that we have like we have in Lombardia in Italy, which is a total overflow, and unfortunately also now in regions of Spain, especially in Madrid, so that people there are not getting the healthcare, the proper healthcare that they would when the disease is a severe disease, or is it even a critical disease, and they need to get they need to be intubated and get air artificially through a machine. And of course, we're talking about countries here that have the luxury of actually having thousands of such beds, even though in Italy and in Spain they have been reduced during the past 10-15 years due to the financial crisis, or at least they still have quite a number of these beds. Of course, this virus is also going to spread to many countries where there's no such thing, and that of course means that in these countries many people would die of this disease. People who could in other countries could have been saved will die of a severe disease, which then becomes critical, and then there's nothing you can do to help these people. So that's why I think what we need to get out to people as soon as possible is treatments that help. And we need to, we first need to find them, but as soon as we find them, we need to make them available, if at all possible, at the most global in the most global way we can achieve in the shortest time frame possible. And I'm thinking, of course, also about these things when I consider a material transfer agreement with one or the other pharmaceutical company. I think we have to put these thoughts aside for the moment, and we have to put health of the global population first, and then we can hopefully get back to a rather normal situation where we can then think about maybe maybe finding a cure again for this type or that type of cancer, and possibly making money on that. That, I think, is the last thing on anybody's mind right now in terms of how can we beat this disease on the therapeutic level. At least that's true for me.
So let's say if I'm a mayor or if I'm in part of a council of the city, what would be I know that you're not a public support on that level, but from a scientific level, because I think we need to go from the top level to the low level. And actually, of course, right now, a lot of the efforts have to be tackled in the city level. And so what would be the let's say, a list of very basic things that you suggest, besides the things that we have, like washing the hands and things like that, but as well more from a council perspective or from a city perspective?
So I have to say that what has been happening over the past week or 10 days in Germany has really been very encouraging with regards to, okay, you do not fully kill any social life. You let people go outside, 2 people at a time, not more, can walk together, can go jogging together. But of course, if it's a family of 3, 4, 5 people, of course they can all stay together because they're together at home. But that's it. Don't and don't extend this to, oh, in these 5 minutes you meet with this person, and the next 5 minutes you meet with another. Be sensible about this. And it looks like people in Germany have bought into the idea. And if we can keep things running like that for the next additional 3 to 4 weeks. So let's say until 21st of April or end of April, I think at least for Germany, I think we can get into a situation where we can, for at least for the time being, alleviate certain aspects of this. And if I put this into perspective of the experiments that we're currently doing, hopefully in a few months' time, we are at the stage that if it were to flare up again in the population, we could actually provide a better treatment for the people who then get into hospital and then get into more severe disease state. I mean, at least that's my optimistic hope that I have, that we can hopefully achieve that through the treatments that we're going to hopefully get into clinical trials very soon. Again, that would be a combination of antiviral approaches and anti-host approaches. So where the host, meaning us, the human being, is driving their own demise by killing their own lung cells. And if we could keep that at a minimum, I think we can actually help people with this disease, and that's what we're trying to do.
So you mentioned Germany. So I think Germany is one of the case studies right now, more from a macro perspective, that is, it has less deaths in terms of from percentage. Could you explain why that happens in Germany? Because I think for the rest of the world, of course, Germany is one of the leading countries, but for the rest of the world, there's, of course, we see the rate death in Italy, right now in Spain, now in the US as well. And we know partly why, but it's important to explain why this is happening, and as well what Germany has been done that the rest of the countries are not doing.
So I think it's not like the health system in Germany would be extremely, I mean, a lot better than, for example, in Lombardy in Italy. I mean, the doctors in Lombardy are fantastic. They're doing a great job. They know how to do intensive care. I mean, the incoming president of the Society of Anesthesiology, of the European Society of Anesthesiology, is a leading doctor from a hospital in Milan. He's giving advice to the world about how to treat the people in this. So they have some of the best medical care. However, they did not have the head start that we had in Germany. And also in many other countries in the world, the testing is lagging behind of what we have been doing in Germany from the beginning. In Germany, the virologists have been advising on testing lots of people from the very get-go of this epidemic, which is now a pandemic. And this is why we had many tests in Germany, so we knew about many people who were infected, and as a consequence, our numbers of known infections are closer to the real infections. We still think there are by a factor of between 5 and 10 lower than the actual real numbers of infected people, but not like in many other countries. These numbers must be a lot higher. I think probably in Italy the number would be 20 to 50 times higher real infections than what are known infections. So if you then make that calculation, then the numbers of deaths that are related to this coronavirus, SARS coronavirus type 2 infection become more realistic also in these countries. And you know, there are estimates of fatality rate of this disease that are in our populations in Europe between 1 and 2% with the intensive care medicine that we can provide. But of course, this means that in many other countries, this may in fact be a lot higher. That said, it is also true, of course, that it mainly affects older people, but rest assured that this is only a statistical number. It can also affect young people, and it can also affect young people very severely, critically, and even kill young people. So this is a message that also needs to get out there. On the individual basis, no one is really safe from this virus.
Okay, well, thank you so much. I don't know if Professor Yu wants to ask any questions. I will keep, I think we are in 40 minutes. I'll keep more or less on this. I don't know as well, Professor Yu, and then I'll just one last question, Professor Henning.
Yeah. So you mean my question right here? Yeah. So I just think, sorry, I switched off the camera. Yeah, I just think, do you think if as a Citiesabc or as myself, also we have some network useful resource, and how this maybe could help you? Because we talk about the global collaboration, we talk about the difference about different countries that treat the disease in different approach, but I think maybe they share with each other, improve with each other. So anything that we could do to help this? Oh, I think it's muted and from Professor.
Yeah, so thank you very much for offering your help in this situation. I think I mean we're very grateful for any help we can get in terms of the research we're doing. And as I said, we're working with a company in China who are making actually the molecules that we are testing in our animal models, and and hopefully they will be able to make also the drugs that then come out of these experiments that will hopefully provide help to the patients, for future patients who will suffer from this disease. That said, of course, your experience with dealing with this disease is going to be very important for countries that are not only currently, but that will also be affected by this disease once the, let me call it the tsunami of the infection rolls over the countries. They need to deal with this, and of course your experience will be very important, and in dealing with this disease in a way that it caused the least damage possible in these other countries as well.
Okay, thank you very much.
So probably to wrap up, and of course in consideration of keeping the time, so Professor Walczak, so any particular things that you suggest, like really urgent things that you can do as a platform first, and as well on the research part, and then on the cities part and the government part, because I think we need to look at the three things as a whole. So like really pragmatic things that you can do right now, and as well people that will see this interview, what you would suggest, from people that are in universities to people that are at home, to entrepreneurs, or to every city that we have where people are. We are all part of cities. So what can we do to be more civic and contribute?
So I think the most important thing is to stay calm, to keep the distance to people. Use the time when you can to spend time with your loved ones in a way that you would normally not do it. So please do use that time. Treat everyone out there with gentleness. If you're waiting in line at a cash register, treat the people in front of you, behind you, and the people who are the cashiers and the people who are working in the supermarket. Everybody that you're meeting, treat people with gentleness, with kindness. I've seen some people being, a bit overreactive when somebody came a bit too close. Just please keep your distance. I'd appreciate that. Say it in a friendly way. Stay friendly, be calm, and let's get through this together. And let us, the scientists, let the doctors, let the nurses work in, do the work. And hopefully we can pull through this together and provide solutions sooner than later.
So one last question, from a scientific perspective, let's say do you think it would help right now to highlight all the different scientists that are working on these clinical trials and try to position this? Because it's one of the things we're doing right now is a data visualization to pick this data, and we found actually quite an enormous amount of research, but trying to put it visible. That helps the community. Any particular thing that you think from a technology perspective we can do right now?
Well, I'm not enough of a technology wizard myself to answer that question. I mean, what I'm doing is I'm trying to activate all the networks that I've built over the past 2 or 3 decades in the research community worldwide, and getting things done. The one thing that I would like to ask from the governments is let us do these things, give us the money so that we can do it. Let's not deal with issues that normally we would have to encounter when doing these things. That said, of course, we want to do it safely for the patients. There's absolutely no question that we're not going to risk anybody's life here, but we need to find something that goes beyond what we can currently do for these patients, because as a matter of fact, people who get this disease, when the lung cells are dying, they're basically drowning in their own blood. So we need to make sure that we stop this disease as it is happening, and that we provide therapies to the patients who suffer from these disease in the worst way. And also therapies to the people who are on the trajectory towards this horrible disease, that we can stop it in its track and get them back again from severe to moderate to mild, and from critical to severe to moderate and mild. So get everybody back so that and keep the people who are on the trajectory towards this from actually getting worse but getting better instead, by blocking the damage that is happening to their lungs.
Yeah, may I ask actually one question? Because when you earlier you mentioned about the treat people friendly in supermarket and politely, yeah, all this I think is very good. Because this reminded me that you know, so there is some cultural conflict. Sorry, that when people, you know, so the Asian countries, they treat the disease, they wear face mask. Okay, but actually in European countries, they don't think of where face mask works. So and this creates some different opinions, especially some people, they say people, Asian people wear face masks, they feel some hostile, you know, so it's already happened. But I just think first is that how we deal with. Second, that whether wear face mask really works or not, if it really works, because if you look at the rate of people, how the countries, the deaths, the line. So in Asian countries, it's very flat, gradually it's controlled. But in European countries, like going up very quickly. Okay, so
Yeah.
so maybe face masks do help, right?
So I think everything can help. I would not say that everybody has to wear a face mask. At least that is my current knowledge. I think but the one thing you talked about, I think it's a very important point. If somebody does wear a face mask and somebody else doesn't, just accept the fact that some people do this, and they don't do this only to protect themselves. They also do this in order to protect others in case they are infected. Think about it like that. So some people, as you say, may think in a hostile way about somebody wearing a face mask. Don't do that. You know, everybody deals with it in their own way. Some people wear a face mask. Some people keep 3 meters or 2.5 meters distance instead of the suggested 1.5 to 2 meters. Let's all try our best to deal with it. No hostility. Let's pull through this together at a distance. Okay?
Yeah, good. Sorry, could I ask another question, Dinis? Do I have time or not?
Of course, yeah, no, go.
Yeah.
Professor
Yeah.
Walczak.
I noticed the news from China. They do a publicity and with all top scientists in China, like academicians in the Chinese Academy of Science, and they announced that the rate in China, the cure rate is quite high. It's because that they also adopted, apart from using the Western medical or medicine approach, they also use the Chinese traditional approach, and they have some of the medicine already listed that they think it's 97% work effective. So as announced by the Chinese Academy of Science. But I'm not quite sure, because this is a Chinese traditional medicine, how you feel this? Would this be helpful, or you think this is not helpful?
I have a very clear opinion about this. I know that there are extremely powerful substances that are contained within the extracts on which the Chinese traditional medicine is based. I know that from my own experience. However, that said, to now go and take an extract of X, Y, Z and pretend this would be working against this disease, I think is going to be extremely harmful. Let's do it the right way. Let's do the clinical trials the right way, the way we know we can identify whether something works or doesn't work. Let's not give the people who are just in there to try to make some money with extract A, B, or C, or with drug ABC. Let's not give them any room, okay? Let's do what we know works, and that is we have to do the evidence-based clinical trials on the basis of which we can decide how we can save lives here, okay?
Okay, thank you. That's all my questions.
So thank you so much, Professor Walczak. Is a pleasure, and I think thank you so much for your valid contribution. We will promote the video and as well probably come back to a next section with different scientists. But for now, it's one step at a time. So have a good day and continue a great research, and we'll keep in touch. Thank you, everyone.
Thank you.
Thank you very
Thank you, Professor.